Good evening, everyone. Dr. Jagruti.
Good evening, ma'am.
Yeah, Dr. Jagruti, just make me host for 2 minutes. I will just make the meeting settings and then make you back host.
Yes, ma'am.
Dr. Jagruti, you spoke with our speaker, sir.
Hello.
Dr. Aarti, you can check your audio and video settings till that time.
Yeah, ma'am.
Yes, it is visible.
Okay,
You
ma'am.
can check. Yeah, audio settings are also visible. Correct.
Okay, ma'am.
Dr. Jagruti can also do the same.
Yes, ma'am. Hello. Is it audible, ma'am?
Yes, perfectly audible. Dr. Jagruti,
Yes, ma'am.
yeah, did you have a word with the speaker?
Yes, ma'am. I called just 2 minutes back. Sir will join in few minutes.
Okay, you want to check your video?
Actually, I'm in the car, ma'am. I'm reaching by 5 to 10 minutes.
Okay, that's okay. Who is going to do the introduction, dear?
Hello.
Going to do. I'm going to do, ma'am. Prajakta, ma'am.
Okay, Dr. Aarti, na?
Yes, ma'am.
Okay, okay. We will start after Sir joins.
Yes,
We'll
ma'am.
wait for
Yes.
him.
Yeah.
Okay. I have shared PPT to both of you. Okay.
Yeah.
So if there is any problem, then we'll have to share from our side. Okay.
Okay, like if DAGA sir is able to do, then we have to share, right?
Sir is not able to do, speaker is not able to do, then we'll have to share.
Okay.
Okay. Yeah.
Yeah.
आमचे कडक Hello, Dr. Prajakta.
Good evening, ma'am.
Good evening, dear.
Sir is just
Um,
sir is just joining in 1-2 minutes. So immediately
Okay.
after sir joins, we'll start.
Yeah. And just check for the slide and all these things.
Yeah, we all three have the PPT. So if sir is not able to do, we will start from our side.
No problem. Okay.
Good evening, sir.
Hello. Good evening, sir. Herlecker, sir.
Sir is, I think, connecting to audio.
Mm-hmm.
Good evening, sir.
Good evening.
We will now start with the webinar.
Yeah. Just check regarding the slide sharing and all, and then we
Yes,
will
yes.
start. Okay.
Yes. Sir, you can start slide sharing from your side. I've made you co-host.
Herlekar sir, can you hear us? Herlekar sir? Dr. Prajakta?
Yes, ma'am. I think there is some network error from sir's
Yeah.
side. I will call sir.
Yeah.
Hello, sir.
I think might be some network issue because sir is not responding.
Yeah, sir didn't pick up the call as well.
Or might be due to he's on another call or something.
Yes.
Have you called him?
Yes,
Prajakta?
I called sir. Sir did not pick up.
It's
I will
something.
try again.
Yes.
Sir is actually on another call.
ओए टूट जाएगी बॉटल भी और वो ग्लास भी
There is
Prajakta?
there is some technical issue from sir's side. Some issue with the browser. I will just call sir and guide him accordingly.
Or you can tell him to join with the mobile.
Yes, I'm going to tell
Rather
that.
than laptop, no, sometimes in laptop it may create some problem.
Yes, I'll tell that to sir.
Okay.
Just give me 2 minutes. I'll speak to sir and get back.
माझं त्याचं कंप्लीट झालं पूर्ण कंप्लीट झाल्यावर काढायचं तर अर्ध
I just now spoke with sir. He is joining with laptop, and now I told him to join with mobile. So he will be here in 1-2 minutes.
Okay.
Good evening, sir.
Good evening.
Yes, sir. Now it
Evening,
is
sir.
audible.
आता आहे का बरोबर?
So you can.
Yes.
Yes. बरोबर आहे, sir. सर तुम्ही स्क्रीन शेअरिंग पण सुरू करू शकता.
हो, आता स्क्रीन शेअरिंग यावरती कसं काढायचं?
सर शेअरचा ऑप्शन आहे ना,
हो ना.
त्याच्यावरती
Share.
जाऊन तुम्ही शेअर मग स्क्रीन करू शकता.
Screen. ते यायला पाहिजे तिथे. ना
Yes, sir.
काढायला लागेल. स्क्रीन शेअर जरी केलं ना तर ते स्लाइड कशा येणार?
सर मोबाईल मध्ये आहे का पीपीटी?
हा, ते प्रोजेक्टच्या ह्याच्यावर आहे ना.
हा सर, मग ते स्टार्ट करू शकता तुम्ही का आमच्या साईडने स्टार्ट करू आम्ही?
नाही, प्राजक्ता त्यांचं असं म्हणणं आहे की ते त्यांच्या मोबाईल मध्ये नाही, तुझ्या मोबाईल मध्ये आहे.
हा, तुझ्या
ओके चालेल.
हा.
आमच्या साईडने आम्ही स्टार्ट करतो मग. ठीक आहे.
तसं कर तू
डॉक्टर
डायरेक्ट.
ना तू
चालेल.
खा ना, मग तुझे करे ना खातो.
आणि
Correct.
प्राजक्ता
Doctor
पहिले म्यूट
Jagrati.
कर सगळ्यांना.
Yes, I'm doing that. Dr. Jagrati.
Yes, ma'am, I'm doing.
Yeah, just start with the screen sharing, na dear.
Okay, ma'am.
Can I start now?
Yes, dear.
Yes. Dr. Aarti, you start. Till that time, Dr. Jagrati will do the screen sharing.
Okay, ma'am. So, good evening, everyone. I feel extremely glad to welcome everyone to this blockbuster masters of 47 webinar series by NIMA-OBGY Central. Myself, Dr. Aarti Nada, coordinating today's session with Dr. Jagruti Patil Madam. Before starting our session, I request all the dignitaries and the participants to take a moment for blessing of Lord Dhanvantri. नमामि धन्वन्तरिमादिदेवं सुरासुरैर्नपादपद्मं लोके चरारुग्भयमृत्युनाशनं दातारमीशं विविधौषधीनां. Let us continue and begin today's webinar. On behalf of NIMA OBGY Central, I welcome all the dignitaries and delegates for today's knowledge enhancing session on the topic prevention of labor without outside intervention. First of all, I welcome dignitaries of NIMA Central, then dignitaries of NIMA OBGY Central, then dignitaries of NIMA OBGY Maharashtra. So today we are very lucky to have here with us Dr. Elekar sir. So I welcome him. So we are honored to have you here, sir. So it's my pleasure to introduce about him. He's a BMS MS in Prasuti Tantra and Sri Rog. He has 28 years of experience as an Ayurvedic gynecologist and obstetrician. He's a director of Suhas Herlekar Gynecology Education Foundation. He's a director of Center for Normal Delivery, running Parivartan Ayurved Rugnalaya at Kothur, Pune. Has a experience of past professor and HOD of Department of Gynec and Ops. He has worked as a past vice principal and deputy superintendent in Ayurvedic College and Hospital of Pune. He has visited Poland as an Ayurvedic consultant in 1998. He's a member of Corporate Doctor Association. He's a director of Membership Development Rotary Club of Pune. He's a member of NIMA OBGY, Maharashtra. He's a resource person for medical training program. He has presented paper on Sthanik Chikitsa Uttar Basti, Tony Vapat, and modalities of Ayurvedic treatment in Mandyatva. He has completed certificate course of laparoscopy. He has OPD at Deccan and Karve Route. He has done thousands of delivery, and his keen interest is natural birth. He has conducted many antenatal courses, and he is currently working as a honorary gynecologist at Tarachan Ramanan and professor at Tilak Ayurvedic College, Pune. He has more than 22 students who have passed MS under his guidance. He has a recognized PhD guide in Tilak Maharashtra Vidyapit, Pune. He's conducting Gynec and Ops lecture for UG students of Ayurveda. He is awarded as Best Teacher by Pune Municipal Corporation. He has even awarded as the Best Ayurvedic Gynecologist and Obstetrician by the hands of Governor of Maharashtra in July 2021. He has attended many seminars and conferences and written a textbook of gynecology in Ayurveda and modern. So, with due respect, I call upon Dr. Suhas sir to start upon this session.
ठीक है, slide share करना.
Yes. Dr.
Yes, sir.
Jagruti.
Ma'am, it is still not working. I'm trying, but
Okay, Dr. Aarti, you have it. Dr. Aarti.
Yes, ma'am. I'm trying. Wait a minute.
Yes.
ma'am, is it visible?
It is visible,
Yeah,
but not slide.
visible. Yeah, you can start that.
Yes,
Correct.
yes.
Start
Okay.
with the slide.
Okay.
Yes.
पहिली slide.
Yes, sir.
Plus slide. First. आवाज ठीक है. Okay.
Yes, sir. Yes, sir. You can start.
So रागा दिरोगान सततान शक्तान अशेष काय पशुतान शेषान औत्सुक्य मोहार अचितान जगान योपूर वैद्याय नमस्ते. Second slide. Next. Next. Welcome you all for this webinar. At the outset, I am thankful to the organizers for giving me this opportunity, and special thanks to Priyanka for giving me this opportunity. Also, thanks for your kind words on the group, Dr. Priyanka. I'm not that much renowned person, but I'm trying to give some inputs regarding the topic. Today's topic is bit little hard to present. It is like a food without salt. Some interventions are there. No single labor is there complete without intervention. Next time. Next. So introduction. You all are might be doing well in the obstetrics at your own setup. I am not going to give you a new inputs or not stating my experience. So many things has to be considered when patients comes into the labor. Everyone has got got his or her own operating system, patient status, family support, nursing home status, and the social support. After all, we are looking for good fetal outcome and minimal complications in the mother. We are more dependent on the investigations. More investigations, more chances of interventions. New investigations are there to look for the fetal and the maternal well-being. Hence, the total management of the pregnancy, labor, and postpartum is changed. So, natural birth insurance is declining. More intervention is practiced during labor. Next slide. Is it possible labor without intervention? Actually, it is a topic of debate. Whether interventions need or not, when to intervene, how to intervene, and what is the result of the intervention. Medical science is basically an interventional science. Needs some interventions to treat it may be medical, it may be surgical, only on the regime basis, and the postnatal period is basically a physiological. So need to intervene only with a specific management. Remember well, it should be intervene only with a specific regimen. It is called as the Garbhini Paricharya. Pari means from all the sides, and Charya means the behavior. Modern obstetrics is deal with minimizing the mortality as the mortality is higher in the pregnancy. So they need to screen antenatal period to rule out the medical disorders and to treat accordingly, and also to see the fetal well-being and hence minimizing the mortality. So some intervention is definitely needed. To intervention, today intervention starts from first day of miscarriage. You might have seen we start the progesterone, we start the aspirin, we start the folic acid, we start the multivitamins, we start the proteins and all that. So intervention starts once the period is missed. Always we consider the pregnancy state as high or as a low risk. We cannot consider the pregnancy as a no risk. So the intervention starts from day of missed period. Next. Friends, basically modern science has divided the pregnancy state in three different parts. It is called as a trimester. The first trimester, second trimester, and third trimester. I personally relate this particular pregnancy state in three particular relations. The first is called as a feto-placental relation, which depends upon the nutrition and the induced diseases. Second one is a feto-maternal relations, where the garbha samskar and the growth of the fetus is more considered. And most important for the related to this topic is a feto-pelvic relation. It is a birth process. Next. What is feto-placental relation? Feto-placental relation, the three important functions are there. One is the source of the protein and the hormones. Second is selective barrier. And third is the control of the fetal growth, development, and maturation, where the today's topic is deals with minimal maternal complications, so good placentation. Pregnancy and transition to prevent parenthood involves great psychological adaptation. The adaptations start in the utero. Mother's physical and emotional attachments start in the utero only. It manifests woman thoughts towards the developing baby. It manifests woman's feeling towards the developing baby. It manifests attitude towards developing baby. So be happy during the antenatal period. If you are happy in the antenatal period, the labor goes without interventions. There is no fear about the labor. And third and the most important part is the feto-pelvic relations. It is most important for the natural birth without intervention. It is important for the determination of the type of delivery, whether induction, whether C-section, or whether the natural birth. The lie is important with the vertical line, cephalic presentation, then chances of vaginal delivery are more. If the presentation is cephalic, the chances of vaginal delivery are more. If the presenting part is a vertex, chances of vaginal delivery are more. If the position is left under occiput anterior, the chances of vaginal delivery or natural birth is more. Engagement is the most part which should be considered to go for the natural the baby head is engaged, the pelvis is normal. If the pelvis is normal, so good fetal pelvic relations, no need to intervene. Motherhood is a gift given by the God to the all woman. Motherhood is a family. Motherhood it is a love. Motherhood it is a contentment, feeling happy. It is a satisfaction. Motherhood is a responsibility. Motherhood is a selflessness. Motherhood is a guardianship. Most important role in the family. So every woman gets motherhood after passing through the painful event of the labor. It is like an heart examinations after studying 9 months of course of the pregnancy. Next, next, what is normal delivery? Normal delivery is a natural process that every woman is capable to bring a child into this world. Bearing certain medical condition, it is largely possible for the pregnant woman to have a natural, normal childbirthing experience. Some medical conditions make it inevitable to carry a C-section for the benefit of the mother and the baby with a very little or a no medical interventions, particularly the use of anesthetics. There is difference between normal delivery and the natural birth. Normal delivery needs some interventions, but natural birth, next slide, there is a difference between natural birth and uh, normal delivery. Normal delivery needs some interventions, but natural birth never need interventions. The birth given vaginal without use of medication is called as natural birth. It is also called as a free birth without any assistance, like a home delivery. We avoid inductions, we avoid augmentation, avoid forceps, avoid episiotomy, avoid enema, avoid the shaving. Charak has given nicely such a upastita kale janmani prasutamaruta yoga parivritya avakashira niskramate apatya pathena esham prakruti anyacha vikruti. Next, why we want a normal delivery? God has made a way to deliver the babies, and women have been doing so since time immemorial. Yours, mine, and the most women's bodies are designed that way. In the wake of prevalent C-section, many women have forgotten that the natural delivery paved the way of quick healing and faster recovery. Natural labor is also shorter and enable the woman to connect to the childbirth experience. closely. Breastfeeding is also facilitated after a natural birthing experience, as both the mother and the baby are fully aware and alert. Yes, epidural can be passed around to the baby, and he may appear to be dragged, showing less or no interest in the breastfeeding. All above, natural birth is often healthier, not just for the mother, but even for the babies. Next. Now we see the definition of intervention. What is intervention? Intervention is the action of becoming intentionally involved in a difficult situation
Voice is not clearly
in
audible.
order to improve or to prevent it from getting worse. It is actually so. Instead of intervening, you should understand where to intervene or the intervention is needed or not. Birthing process is said to be physiological, may not need any intervention if it goes smoothly. Observation, patience, assurance, and trust prevent the intervention. Observation, patience, observation to the patient, patience of the obstetrician, patience of the patient, patience of the relative, and assurance given by the doctor to the patient, and the trust of the patient on the obstetrician prevent the intervention. Next, next slide. Slide next करा. What are the common interventions done? 80% enema. When the patient admits, we give the orders, prepare, shave, and enema. 80% patients are given enema. Why enema is given, don't know, but it is given. It is an given for so many years. 22% perineal shaving. 22% perineal shaving. It is done routinely in every patient. Whether it is needed or not, don't know, but it is done. 70% induction. 70% induction.
Hello, sorry for the interruption. I request all the other participants, please keep yourself muted during the session.
One more thing, Dr. Jagruti, if you can just make me and Dr. Aarti co-host, we can mute these people. So please,
Yes, ma'am.
can you do that?
Yes, ma'am. Yes, sure.
काय झाले?
सर एकच सेकंड ना. ते ऍक्च्युली ऑडिओ डिस्टर्बन्स येतोय ना. एकच सेकंड.
Yes, ma'am.
Thank you so much. So please continue. Thank you.
आधीची स्लाइड घे, आधीची स्लाइड. Intervention. So these are the common interventions done during patient gets admitted. First is the 80% enema is given. 22% perineal shaving is given. Perineal shaving may be responsible for some infections. 70% inductions. Many times inductions is done. 95% electronic fetal monitoring. The patient is kept on the bed and the machine is applied to the patient. So patient cannot move. So this is very wrong unless and until the fetal monitoring is necessary in high risk pregnancy. It should not be used for the routine. 72% multiple PVs are done. PVs. 31% amniotomy and 71% intravenous fluid is allowed. Next. Next. Let us see the definition of the labor, because once we know the definition of labor, we can able to diagnose the stages of labor. This is the one which is the most nicely explained definition. It is called as coordinated effective sequence of involuntary action of uterine muscle resulting in effacement, dilatation of cervix, which terminates into expulsion of the products of the conception, that is fetus, placenta, and the membranes. So, in this definition, they say that the labor should be coordinated. There should be coordination from the uterine muscle to the cervix. There is a polarity when the fundus contracts, the cervix dilates. So this polarity should be maintained in the labor. If the polarity is maintained, the labor is said to be normal. So no intervention is needed. It is effective sequence of involuntary muscles, and it directly act on the cervix. The first it does the effacement, and secondly it goes for the dilatation. So this is a nice definition of the labor. Labor is a life-giving pain. Labor is a work. It is a mechanically work is generation of a motion against the resistance. Motion is generated by the force or the power. Here, the force is uterine muscles and the abdominal muscles, and the resistance is given by the cervix and the tissue. So, the uterine muscle has to overcome the resistance of the cervix and the tissue and have to pass the baby through the birth canal. In Ayurveda, it is called as avi, grahi shul, or it is called as a receptive type of shul. It is receptive. It receives some type of signal. Next. The most important is the diagnosis of labor. Labor pain should be diagnosed properly. Its intensity, duration, frequency should be correlated with the cervical change. Pain comes with the irritable uterus, but there is no cervical changes. But we say that it is she is in labor, and we intervene unnecessarily. So, the the cervical changes. If the intensity, duration, and frequency correlate with the cervical changes, then it is called as a true.
Hello.
Hello, sir. Hello, sir.
Hello.
Yes, sir.
काय झालं?
सर ऍक्च्युली व्हॉइस कम्प्लिटली गेला तुमचा आणि व्हिडिओ पण गेलाय.
होत नाही का?
येस सर, नाव विजिबल. हो सर.
आलं का आता? हे झाले का? ऐकू आलं का डायग्नोसिस ऑफ लेबर?
Yes.
हॅलो.
सर सर
ऐकू येते का?
एंडिंगला थोडं ते तुटत होता आवाज ऍक्च्युली.
अच्छा अच्छा. आता बरोबर आहे का?
Oh, sir.
Acha. So diagnosis of labor should be done properly. Its intensity, duration, frequency should be correlated with the cervical changes. Many times the patients come with the labor pain, but the intensity, duration, frequency cannot correlate with the cervical changes, and hence we many times intervenes and the labor become problematic. So instead of that, diagnose properly. If the contractions are with a good intensity, good duration, and good frequency with cervical changes, it is called as a normal labor. Management should be according to the stages. Each stage has got a specific principle. Latent phase is merely preparation. So management should be according to the latent phase. First stage is simply cervical erection. So no need to intervene, no need to augment. Second stage is just expulsion of the fetus. Contractions are more, intensity is more. The relaxation period is less. Third stage is only expulsion. There is one single contraction which expels the placenta outside. So these are the main principles. So uterine action is different at different stages. Each stage has got a specific time duration. So to achieve the target functions. Labor is a time bound processor. Remember well, labor is a time bound processor. This is some Garbha Prasava Hetu explained in the Ayurveda. This is a Kala, Garbha Poshan, Vayu, Prakopavastha. Vyan Vayu responsible for the Prasaran and Akuncham. Apan Vayu responsible for Garbha Nishkraman and the Vyas of the Garbhashay Mukha. Kapha is responsible for Shathangatva. Pitta is responsible for uh, maturation of the placenta. So this is some Prasava Hetu explained into the Ayurveda. Next, parturition. What is parturition? Parturition is the act of giving birth. It is being delivered of young.
20 मिनिटं झाले.
The process of giving birth, childbirth. It encompasses all physical processes, uterine action, cervical changes, abdominal muscle force, mechanism of labor, flexion to the external rotation. Next. When parturition starts in the initiate at the conception. When the conception takes place, the placental hormones are responsible for making some changes in the uterine muscles and some in the skeletal muscle. So the parturition process starts when the conception takes place, but the conception should take place in the uterine cavity. Hypertrophy of the uterine muscle, smooth muscle, need for the contractions. Proper orientation of the long axis of the fetus with the long axis uterus is responsible. Vertical line with cephalic presentation or with breast presentation, the parturition starts. Maturation of the fetus, it is called as Garbhavasa Vairagya. It is a Vayu Prakopavastha is responsible for starting of the parturition. Next. There is fear related to the pain. Patients may have the fear. So gynecologist obstetrician has to counsel for the patient regarding this particular pain. This pain is very different type of pain. Pain is an unpleasant sensation which is a beneficial. It is beneficial for all. It is beneficial to diagnose the disease. And here it is beneficial for deliver the baby. So don't worry about the pains associated with a normal delivery. While you are pregnant, read good literature and keep your spirit lifted. Think about you are the child and feel strong. It is after all the baby that matter the most, whether the baby is delivered by the C-section or the via normal delivery. The most important point is to be happy and the feel special. You are having a new life in your womb. The thought itself is so exciting. Enjoy every moment of your parenthood and be mentally prepared for the new arrival. When you are happy, feel good hormone is released that keeps you high spirited and eliminates the feeling of anxiety and the worry. Such type of counseling should be done to the patients. Then the patient directly go into the normal level. Next, what is the mother outlook related to the labor, related to the delivery? There are different expectations, different type of fears, different type of aims. Someone wants to handle this emotional experience on their own. Some make use of all the technology which is used for the labor, like epidural anesthesia and all that, and for safe application and all that. We cannot impose our own opinion on the patient. Woman should use her own resources. Middle class women like to demand natural birth. Working class want it to be a comfortable. It may be epidural, it may be cesarean sections, but the middle class woman definitely want a comfortable delivery. Next, the fear. What is fear? It is tocophobia. Childbirth is one of the most painful events that the woman likely to experience. So, tocophobia is a mental health condition. She might have some traumatic experience. She might expect expectation about the gender or fear about the fetal outcome. So that fear may convert into some type of interventions. Next, some expectations are there. How can I know about the pain? So when patients comes in your consultation, so you counsel related to the pain. What can be done to initiate the pains, natural pains? Can I reach the hospital in the time? Can I bear a pain? Which is the most painful part of the labor? This is some expectation. So you have to clear all the expectation before the patient comes to the labor. Next, motherhood is the highest qualification achieved by every woman in her life. It is like a competitive examinations. It is great honor which woman gets by delivering a baby after a 9-month course of pregnancy and appearing for hard examination as a parturition. Someone get easy paper like so get delivered without help. Someone get hard paper, needs some interventions. Someone need help like instruments, surgical interventions. Success of examination depends upon the good efforts taken before examinations. Like that, you need to have a healthy regimen and positive outlook towards the pregnancy and towards the delivery state. Healthy diet, minimal exercise, meditation, yoga, regular medical follow converts into non-interventional vaginal delivery. Next, what is today's scenario? Today's scenario is totally changed. Pregnancy become more stressful. More intervention starts from missed period to delivery and postpartum. It is treated like a disease. So many investigations, so many medicines. It is need to clinical evaluation first and then go for the investigations. If you feel there is a oligohydramnios, if you feel there is IUGR, then go for the sonography. Many times the sonography is done and some other uh, findings are there which can be responsible for the interventions. So manage it on the dietary regimen. Need to cope with the signs and symptoms. Many are due to the growing baby. Inclusion of Garbha Sanskar, exercise and yoga makes more stress on the antenatal care. Unavailability of the veterans, elderly, experienced women at home. Use of more social media, unnecessarily advised by the most important, unnecessarily advised by the friends, relatives, as it is a nuclear family. Next. This is the most important attitude for the normal level. Basically, we learn about the attitude of the fetus. But here, I want to explain attitude of a mother, attitude of the fetus, and attitude of the obstetrician. What is attitude? Attitude is the way you think, you feel, or you behave. Fetal attitude is a relation of a different parts of fetus to each other. So there are two attitudes. One is the flexion, second is the extension. Flexion is a normal attitude. Spontaneous labor. With the flexion attitude, vaginal delivery takes place irrespective of the type of the pelvis without any interventions. Second, maternal attitude. Mother should think, feel, to have a natural birth and should behave like that, so no need to intervene. So mother should have a positive attitude. The most important is obstetrician attitude. Being a medical attendant, diagnosis of the stage of labor and the proper management of that particular stage do not need any intervention. So supportive attitude should be there by the obstetrician. Next. In normal labor, we learn about the 3P. One is a passage, passenger, and the placenta. Here, I explain 3P for the non-interventional labor. The first is a patience. What is a patience? Patience is the ability to wait or to continue doing something despite difficulties or to suffer without complaining. That is most important. To suffer without complaining. Patient, doctor, and relative should have the patience. Second is a passion. Strong feeling of enthusiasm or the excitement for something or about doing something. That is called as a passion. Obstetrician should have passion of natural birth. Perception, a particular way of looking at or understanding something or the opinion. The ability to understand. The patient should understand the process of labor and the obstetrician should explain it properly to the patient. Next. Today's birthing scenario is changed. Medical intervention is increased. Augmentation, induction, ARM, cesarean section rates are increased. Labor become more complicated. Routine use of intravenous fluid makes the patient bedridden. Electronic monitoring for the fetal well-being makes the patient bedridden. Induction, augmentation, epidural ablation, artificial rupture of membranes are increased. Multiple PV examinations may get patients troublesome. So this scenario we have to change. Next. How to overcome the interventions? Teaching about the birth process. Explain the patient regarding the how the patients come with labor, what is the labor, how the labor progress, which is the highest point of the labor. So we have to explain properly. Asking them to practice the relaxation technique. This relaxation technique should be practiced in antenatal care. Practicing meditation and yoga. Eating healthy diet. Asked to do minimum exercise. Asked to share good things with someone to whom you trust. Having comfortable position according to the stages. Next. We routinely advise the exercise to the patient, but the exercise is not directly responsible for the natural birth. It enhances the natural birth without intervention by increasing the pain threshold. Childbirth call for the energy and the stamina. Exercise build the energy and the stamina. It gives physical fitness, increase the pain threshold, increase the oxygen consumption capacity. So less chances of meconium stain like that. Garbhogarbat, Ati Vyayam is a contraindicated. Next, yoga therapy. I routinely advise the yoga therapy rather than the exercise because yoga therapy gives the flexibility. Breathing exercise. First stage to cope with the pain. Second stage to push the baby. It is a mother efforts. It improves the sleep, tone of the physical body, gives the pelvic floor relaxation, which is responsible for the mechanism becomes both. It gives the physical relaxation, it minimizes the physical stress, and it gives the mental relaxation. It removes the mental stress. Role of position in the labor. Position is the most important part for the non-interventional labor. Position gives more comfort during different stages. Comfortable position minimizes the intervention. Specific position never matter. Comfort of the position matters. Position help in controlling the pain. It helps the baby to open the pelvic floor. It as the axis is coincides. It helps the transferring the pain in the lower segment. In first stage, it helps the becoming energetic, and in second stage, it is beneficial to push the baby downwards. So, if the position is proper, no intervention is required. Next. So these are the positions. The first stage, upright, sitting and standing. Second stage, supine, squatting, standing or sitting. Any position you can use for the second stage of labor, but we can commonly use the supine position. We cannot do the delay with the squatting or standing or the sitting position. Ayurveda says that avi pradirбhaveshu bhumoshayanam. When there the pain is increased, patient is asked to sleep on the floor. Next. This is hugging related to the labor. Next. Next, the responsible is most important part is the relaxation. Relaxation. If there is a good relaxation, no interventions. Practice the relaxation techniques in antenatal period that I told you. Coordinate with the Braxton and his contractions. Relaxation makes you fit and fearless. Relaxation is a breaking vicious cycle, pain, fear, and the tension. It helps to prevent unduly becoming tired, control her thoughts and emotions, relaxation in between two contractions. So relaxation, sleep, sit on the chair, walk around the ward, drink some water or the fluids, share your thoughts with your friends or the person who is attending you, massage the back, and if you want, listen the music which you want. Next. Why to relax? Body works better. Good. More energy baby cope with the labor. Very less. Unless next How to relax? Concentrate on the respiration. This is the most important part of the relaxation, which gives the more oxygen, and more oxygen is responsible for getting good relaxation. Use comfortable position. Involve your partner in the process. Listen music. Massage your back. Deep breathing in between two contractions. Next. Relaxation prevent tiredness. Control emotional feeling. Relaxation makes you fit and fearless. Hence, the birth is tireless and it also without interventions. Next, perineal massage. This is the one most important thing I am going to practice in my routine of studies. That is called as a yoni abhang. It is not given in our text. It is given a yoni pishu. But the yoni abhang is the most important to avoid the episiotomy, to avoid the perineal tear. After 36 weeks, you can give the perineal massage. Simple massage technique is squatting or leaning with well support. Prefer partner to do it. Use some oil. Use index finger, middle finger, sling type of movement, upward along the side wall and downward with a pressure. Stretch few seconds to 30 to 40 seconds. If you go for the perineal massage with oil or the yoni abhang, the introitus becomes elastic, and if you deliver the baby with the flexion by giving a pressure on the perineum, the chances of episiotomy are reduced, or the chances of perineal tear are also reduced. So this is the most important you can use in your routine practice, but it is somewhat difficult. Next, 9 tips to non-interventions. 1. Regular mild exercise. Refrain from the stress. Breathe properly and rightly. Refrain from the horror stories of the birth. Choose good hospital, the most important. Education about the process of delivery. Proper support. Perineal massage and doctor consult at a particular time. Next. What are the benefits? Avoid the potential side effects of the interventions. Free to move during labor. She can share her thoughts with her caretaker. Experience every event. Quick recovery. Low incidence of interventions. Feed baby immediately. Listen the first cry. If we listen the first cry, she forgot the efforts taken by the listening. The first cry. This is the most important. If you ask the patient, do you have any problem in the uh, delivery? She said no, because she listened the cry of the baby. Next. Now the last one. Note for the body. Avoid USG third trimester unless indicated. Many times the 9-month sonography is done, and some problems are there, like a cord around the neck, and there is a fear in the mother, in the relative, and also in the obstetrician. So avoid the USG in the late trimester unless and until it is indicated. Wait till labor starts. Don't hesitate to induce the labor with a castor oil, all that. Unless there is no good bishop score, don't try to induce the labor. So wait till labor start. If the labor start, that indicates the baby is mature. If the labor start, that indicates that all the receptors are formed in the uterine muscles, the chances of postpartum hemorrhage are reduced. Look for the engagement of the head, whether the head is engaged or not. See the bishop's score if needed induction. Don't admit the patient in the latent phase. If admitted, administer the sedation. Ask for monitor the labor at home for 2 hours. If rhythmic, ask to admit. Avoid multiple PV examinations. Use electrofetal monitoring only in the high-risk patients, not routinely. Ask to take a clear fluid inactive phase. Position, walking around, sit on the relaxing chair. Take the help of the partner and massage. Listen the music and share things with a partner. So thank you everyone for listening calmly.
Thank you so much, sir, for the wonderful session. With your due permission, should we start with the question and answer, sir?
Yes, yes, sure.
It's truly wonderful,
Thank
sir. Sharing very simple and the practical things that we needed for the normal labor. Thank you so much, sir.
Okay, okay. Thank you, thank you. Okay.
Thank you so much, sir, for this wonderful session. Now I invite Dr. Jagruti ma'am for start with question and answer series.
Before starting question and answer series, I request all the participants, if you have any query or any question, please put your question in the chat box.
What time we can start with the Pichu insertion in the Matravasti? Really speaking, I never use the Pichu, basically, in Matravasti after 36 weeks.
Thank you, sir. The next question is, any Ayurvedic drugs used in the augmentation of labor?
No, I never use the for augmentation, basically. But for induction, I use the castor oil only. It has got a nice result. Unless and until I see the whether the head is engaged, cervix effaced, good effaced, then I advise the castor oil. Because the cervical changes are most important for induction. If the cervix is well effaced, you can give anything, the patient will go into the labor. Castor 2 teaspoon at midnight. ऐकू येत नाहीये आवाज नाही
Hello, is it
हा बोला
audible, sir? Yes, yes.
Yes, yes.
The next question is, what are the possible changes of not getting any perineal tear by avoiding episiotomy and doing yoni abhyanga?
It is possible chances.
Yes, yes, sorry.
काय काय म्हणले
What are the possible chances?
If you do the uniabem and if you deliver baby with a flexion, then the chances of episiotomy are less. Many times we deliver the baby with extensions. So extension makes the more diameter to the introitus, and the chances of episiotomy are increased or the perineal tear increases. If you do the delivery with the flexion, you have to give the proper support at the perineum and deliver the baby head with a flexion. Then chances is very less. But you start from 36 weeks of pregnancy, so we can get the 3 weeks for getting the relaxation of the perineum.
Yes, sir. Thank you so much, sir. The next question is, choice of oil in Matra Basti as per your clinical experience.
I generally use the Balatir, 30 ml.
So the next question is, please kindly give your experience about the Yoga Basti in last trimester. Or should we advise Yoga Basti or only Matra Basti in last trimester?
I advise only the Matra Basti. I never advise the local Yoga Basti to anyone.
Okay.
Because labor process is totally different. That's why I'm told you I use total mechanism.
Yes.
So I don't know whether it acts or not, but I use Matra Basti routinely.
Okay.
But
So
not the Pichu, not a Pichu. Because with the Pichu, chances of premature rupture of membranes are there. And it becomes more troublesome to use the Pichu for the patients. But other than that, if you use a perineal massage, it acts nicely.
The next question is, if patient passes her EDD, should we wait for next 2 weeks or up to 42 weeks, or should induce her?
Yes, if the passes expected due date, do the sonography, see the amount of the liquor, and you can wait 1 week after that. Because the EDD may change. Nowadays, we are going to see the EDD by the USG only. We never correlate with the last menstrual period. So many times it gets changed, and we say post-datism is basically diagnosed properly, because many times we cannot diagnose with the LMP. So 12 weeks sonography can give you the proper expected due date. See the cervical changes, see the amount of the liquor, see the presenting part, and then decide whether to go for wait for 1 week or not. Because placental maturation and the baby's maturation we cannot see the baby fetal maturation. We cannot see the placental maturation. We directly go for the postdatism according to the LMP or according to the sonography. So the changes of the cervix gives you the maturity.
Yes. So the similar question according to that. If patient come to the OPD and she has liquor or AFI up to the 5 or 6 centimeter, and on examination there is some slight leaking is there, and she will not give you a follow up, and she will try to do natural vaginal delivery. So should we give try or not for such questions? At the AFI of 5 to 6.
Hello, sir.
You can apply. Nurse is a problem. Yes, yes. Wait. Bola. Hello.
Yes,
Yes,
sir.
okay. This is audible now.
बोला.
तर हा मगाशी आवाज येत नव्हता. बोला ना सर.
नाही लिकिंगचा पेशंट जर असेल, लिकिंग, if the patient is leaking, AFI is a 5, wait till the cervical changes occurs.
Okay.
In my clinic, for leaking patient, I wait for 36 hours by giving a proper antibiotics.
Yeah.
Patient smoothly goes into the labor, and if needed, you can induce with a pitocin. Pitocin is the nice drug.
Yes. What all yogasana can favor natural birth?
Huh?
What all yogasana can favor natural labor?
See, I told you that yoga and the exercise is not responsible for the natural labor. Labor depends upon the peto-pelvic relations. But the yoga and exercise gives your oxygen consumption capacity and increase your the pain threshold. They are not directly responsible for the natural labor.
Yes. Thank you, sir. The next question is, what is your perspective towards water bath delivery?
No, I not observed it, but when I was in the Poland for 3 months, so I observed there is a water bath. But it is no difference whether it is a water birth or whether it is the labor room birth. It never makes any difference. What Ayurveda said, Bhumoshayan, what? This is the most important part.
The next question is in primary patient, as engagement is prior 1 week, approximately 1 week before the onset of labor, and she is present with show and contractions, and head is still floating. So should we wait or induce or plan for the section, considering inlet CPD?
Inlet CPD. What is the question? Primary patient with
Present with the show contractions, means 3 contractions for 30 seconds for 10 minutes, and head is still floating and present with the show. So should we wait or induce or plan for the section? As in primary patient, engagement will be should be for at least 1 week prior.
You wait till the patient starts the labor. Cervical dilatation is different and the pitopelvic dilation is different. If the patient goes smoothly and cervical dilatation progressively takes place, no way to do the cesarean section. Engagement of the head depends upon so many factors. There may be the deflection, there may be amount of liquor is more. If the patient is premature and patient is showing some labor signs, so wait. Why go for the cesarean section?
Okay. The next question is, when patient is admitted for labor and we are waiting till 24 or 36 hours, what type of food intake you advise, sir? Like only liquids, solids, or juices?
Clear liquids or the semi-solids. Basically, clear liquids.
Yes. The next question is from Dr. Sanita. 30 ml Matravasti is given once or twice a week.
I give up to 36 for 1 week every day.
Could we give trial to the patient in of PIH for the normal delivery if it is uncontrolled PIH?
See, any pregnancy-induced disease, if you go for the natural birth, the incidence of mortality becomes less. Surgical interventions always increase the mortality. So, for going for the induction, you have to see whether the pelvis presenting part, cervical status, and go for the inductions. Inductions is the best method for PIH and diabetes patient. But it depends how much the drug act on that particular thing. What is the cervical status? What is the Bishop score? According to that, you can go for, not necessary to go for the cesarean section for every pregnancy-induced diseases.
Thank you so much, sir, for solving our all the doubts.
Okay.
The next question is, anything can be done to improve Bishop's at 40 weeks?
No. Bishop score can be, once the placenta gets mature, when the head gets engaged, the prostaglandin, hyaluronic acid gets secreted, and when prostaglandin secretes, hyaluronic acid secretes, the cervical changes occurs. No other intervention is needed for the increase the Bishop score. Mind well. No pichu, no basti, nothing. The placenta should get mature, head should be engaged or head should be there in the lower segment. Lower segment should get dilated and the chorion should get some type of separations by means of which the prostaglandin is secreted, the hyaluronic acid is secreted, and the cervical changes takes place. The Bishop score is only depends upon that.
The next question is, which yogasanas do you advise according to first, second, and third trimester?
Yogasan?
Yes.
No, I don't advise any type of, that is not my part of the yoga. I'm dealing with antenatal care and that. Basically, exercise, yoga is a part of the Garbha Sanskar. I'm not more believe on that.
The next question
So,
is, stripping should be done or not? Stripping should be done or not?
Not stripping. See, after all, the Bishop score is important. Every obstetrician, when do the per vaginal exam, he always stimulate the cervix. I don't understand why they stimulate the cervix. Not necessary. It should start naturally by the maturation of the placenta. No need to stripping. So many gynecologists do the strong stripping and give the prostaglandins, deliver the baby. But I don't believe on that. Wait till the some sort of the labor starts. It may not be the high for the intensity, but there should be some irritability in the full term.
Yes. So thank you so much, sir. So on behalf of NIMA OBGYN Society Central and NIMA OBGYN Society Maharashtra, I would like to express my gratitude to NIMA, all the dignitaries of NIMA Central. I extend my gratitude to our NIMA OBGYN Central President, Dr. Kamini Diman ma'am, Secretary, Dr. Priyanka Nakre ma'am, Treasurer, Dr. Vishnu Bhavne sir, and Convener, Dr. Rajesh Upne sir, for supporting and guiding us to conduct today's webinar. I would also like to thank and extend my gratitude to our eminent speaker, Dr. Suhas Erlekar sir, who took time from her busy schedule and delivered very knowledgeable and wonderful session and give highlights on every small point that we should have. I would further like to extend my gratitude to our NIMA, all the dignitaries of our NIMA OBGYN Maharashtra Society. I would also like to thank Dr. Girish DAGA sir and Dr. Prajakta Patil ma'am for all the help and technical support. And last but not the least, I would like to thank from the bottom of my heart to all the delegates of for their participation and presence. Without them, this webinar would not have been possible and succeeded. And I would also like to thank Dr. Aarti for coordinating today's webinar. Now, with due respect of all dignitaries, I am concluding today's webinar. Thank you all for attending and hope you have learned and gained great knowledge from today's webinar. Thank you. Thank you so much all.
Okay, thank you. Thank you.
Thank you, sir.
Ma'am, should I end the session?